Dorothea Orem Self-Care Model presentation by Tina Williams, Certified Occupational Health Nurse Specialist and Northwest Nazarene University Family Nurse Practitioner student. We will not only uncover Orem's self-care model, but explore a variety of applications. Dorothea Orem recognizes self-development by holding professional roles throughout a nurse's lifetime. This value started in 1930 when she obtained her diploma in nursing. She worked as a staff nurse, a private duty nurse, as nursing faculty, administrator, and consultant, all while continuing her education, just like we are. In 1939, she earned her Bachelor of Science in Nursing Education, then in 1945 graduated with a Master's in Science in Nursing Education. She then published her self-care concepts in 1959, and in 1980 published the self-care theory in the Nursing Concepts of Practice. Without further ado, let's dive into Orem's self-care model that provides structure where the nurses assist their patients where needed to maintain an adequate level of self-care. The amount of assistance the nurse provides depends on the patient's ability to perform self-care. As you are well aware, nursing intervention is required when your patient has the lack of maintaining quality therapeutic self-care that sustains life, health, disease or injury recovery, or even coping mechanisms. This self-care gap could be for the patient themselves or their children. There are three interrelated concepts: self-care, self-care deficit, and nursing systems. Self-care includes four aspects. Self-care is what people independently do to maintain their own or their children's health, ultimately contributing to human development. Self-care agency is the person's ability to engage in self-care, and basic conditioning factors can affect a person's ability to perform self-care due to age, health status, sociocultural factors, insurance, family influence, socioeconomical, environmental, and even access to resources. Therapeutic self-care demand is any required healthcare intervention to meet the person's self-care needs, which could be an isolated acute issue or chronic healthcare maintenance. Adequate self-care requires a primary foundation of sufficient air, water, and food, functioning elimination system, a balance between activity and rest, time of solitude and social interaction, reduced risk of hazards, and ability to fit in and grow within social groups. When health care is sought for an illness or injury, then self-care additionally includes the ability to seek health care, appropriately respond to the pathologic results, effectively manage prescribed interventions, ability to monitor one's own interventions. Life challenges may require additional medical resources. Adapting to a modified life when pathologic conditions have affected one's life while promoting personal development. Self-care deficit results when your patient is incapable of providing effective self-care continuously for themselves or their children. Therefore, a nursing intervention can educate them to enhance their self-care abilities. There are 5 methods of assisting, which includes doing it for them, guiding them, physically or psychologically supporting them, providing and maintaining an environment that supports personal development, and teaching them self-care. Nursing systems is identifying a knowledge or ability gap between therapeutic self-care demand and the self-care agency by filling in with a nursing intervention. 3 nursing systems include the wholly compensatory system, in which the nurse cares for the most required needs; partially compensatory system, in which the patient performs some and the nurse performs the rest; Supportive education system in which the patient provides self-care and together they regulate exercise and self-care agency development. Let's put Orem's self-care model into practice. An example of supportive self-care could be coordinating or teaching a teenager how to draw and administer their insulin. Partially supportive self-care example could be setting up a nebulizer treatment for a patient while they perform the treatment. And wholly self-care example could be providing all of the steps of a treatment, like tube feeding for a cerebral palsy. As you think about these examples, what change would move them into a different category? What if you were teaching a parent how to perform the tube feedings for their child? That's right, it would be supportive self-care. And what if you set up a nebulizer treatment and administered it with a face mask? Correct, that would be wholly self-care. And what if you referred your diabetic patient to the Humphreys Diabetic Institute for Diabetic Education and then continued to monitor their fasting blood sugars, A1C, and adjust their medications until stabilized? Yes, that is a prime example of a family nurse practitioner providing supportive resources and education for their patient's self-care. What do you think the supportive care would entail with a patient who has cancer? What partial care can you refer, delegate, or provide while maintaining some of the self-care of the patient? And finally, how would you refer, delegate, or provide wholly self-care for your cancer patient? Select one of these elements and fill in the missing nursing system and support it with a self-care nursing intervention. I look forward to reading your self-care systems. Thank you, and here are my references.